Assalamualaikum warahmatullahi wabarakatuh. Our group will talk about depression, which is types of depression, symptom of depression, and cause or factor of depression. What is depression? Depression is a state of low mood and aversion to activity. It can affect a person's thoughts, behavior, motivation, feelings, and sense of well-being. It may feature sadness, difficulty in thinking and concentration, and a significant increase or decrease in appetite and time spent sleeping. People experiencing depression may have feelings of dejection, hopelessness, and sometimes suicidal thoughts. It can either be short-term or long-term. The core of symptom of depression is said to be anhedonia, which is referred to loss of interest or loss of feeling of pleasure in certain activities that usually bring joy to people. Next, types of depression. Depression can be broken into categories depending on severity of symptoms. Some people experience mild and temporary episodes, while others experience several and ongoing depressive episodes. There are two main types of depression, which is major depressive disorder and persistent depressive disorder. Major depressive disorder. Major depressive disorder is the more severe form of depression. It is characterized by persistent feelings of sadness, hopelessness, and worthlessness that don't go away on their own. Second, persistent depressive disorder. Persistent depressive disorder, PDD, used to be called dysthymia. It's a milder but chronic form of depression. In order for the diagnosis to be made, symptoms must last for at least 2 years. PDD can affect your life more than major depressive because it lasts for a longer period.
Assalamualaikum warahmatullahi wabarakatuh. I would like to present about depression causes. There are several possible causes of depression. They can range from biological to circumstantial. Common causes include: first, family history. You're at a higher risk for developing depression if you have a family history of depression or another mood disorder. Second, early childhood trauma. Some events affect the way your body reacts to fear and stressful situations. Third, brain structure. There's a greater risk for depression if the frontal lobe of your brain is less active. However, scientists don't know if this happens before or after the onset of depressive symptoms. Fourth, medical conditions. Certain conditions may put you at higher risk, such as chronic illness, insomnia, chronic pain, or attention deficit hyperactivity disorder. And fifth, drug use. A history of drug or alcohol misuse can affect your risk. About 20% of people who have a substance use problem also experience depression. In addition to these causes, other risk factors for depression include: first, low self-esteem or being self-critical. Second, personal history of mental illness. Third, certain medications. And fourth, stressful events such as loss of a loved one, economic problems, or a divorce. Many factors can influence feelings of depression, as well as who develops the condition and who doesn't. The causes of depression are often tied to other elements of your health. However, in many cases, healthcare providers are unable to determine what's causing depression. Thank you.
Depression. Depression can be more than a constant state of sadness or feeling low. Major depression can cause a variety of symptoms. Some affect your mood and others affect your body. Symptoms may also be ongoing or come and go. The symptoms of depression can be experienced differently among men, women, and children differently. Men may experience symptoms related to their mood such as anger, aggressiveness, irritability, anxiousness, and restlessness. Behaviors such as loss of interest, no longer finding pleasure in favorite activity, feeling tired easily through exercise, drinking excessively, using drugs, engaging in high-risk activity. Women may experience symptoms related to their mood such as irritability, emotional well-being such as feeling sad or empty, anxious or hopeless, sleeping pattern such as difficulty sleeping through the night, waking early and sleeping too much. Lastly, children may experience symptoms related to their mood such as irritability, anger, mood swing, and crying. Cognitive abilities such as difficulty concentrating, decline in school performance, changes in grade, physical well-being such as loss of energy, digestive problem, changes in appetite, weight loss, or gain. That's all from me. Thank you.
Last but not least, everyone knows that when someone is under depression, her life will be miserable and it will affect her daily life. So I hope we all can avoid ourselves to involve in under depression situation. Thank you. The conclusion is depression is a mood disorder that involves a persistent feeling of sadness and loss of interest. It is different from the mood fluctuation that people regularly experience as a part of life. Major life events such as bereavement or the loss of a job can lead to someone to under depression. However, doctors only consider feelings of grief to be part of depression if they persist. Depression is an ongoing problem, not a passing one. It consists of episodes during which the symptoms last for at least 2 weeks. Depression can last for several weeks, months, or years. Okay, signs and symptoms. The symptoms of depression can include a depressed mood, reduced interest or pleasure in activity once enjoyed, changes in appetite, sleeping too much or too little, agitation, restlessness, and passing up and down. And lastly, feeling of guilty.